So the tibia, the joint's this way, like this, not like this. It's like this. So you want to pull the tibia this way, not up to the ceiling, but at an angle kind of like that. Okay? Which is important because if you try to pull it straight up this way, you're going to have the tibia hit part of the femoral condyle, and it will stop it. And so it'll make it look like a negative test when it's really positive. Let me score. This knee's okay. So the true Lachman's is basically you do the most accurate way of measuring knee flexion is you eyeball it. That's about 20 or 30 degrees. Sometimes people will kind of do a pre-wiggle. Okay. And then a quick, like that. Sometimes there'll be a counter force on the femur that way. And it's a slap. Okay? Now my hand is around as much of the tibia as possible to guide or direct that tibial tuberosity right toward my sternum. Okay? Not laterally like that. All right? And that's really hard to do because a lot of times you can't get your hand around their leg. Oh, sorry. Okay. And you'll feel this little just snap or slap. Thunk, 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 thunk. Feel that? Thunk, thunk. Okay. So that's one way to do it. Gotta keep you guys awake with something. You know? It's rainy, I want to go see peeps, you know? All right. So, flex the knee. Here's another way. Stabilize the femur. All right. And then grab. And I like this. It's called, I think, was it stable Lachman or what do they call it?
Yeah, stable Lachman.
What the hell is that? Or check for instability, so we call it a stable Lachman. Every time it's negative, it's stable. But you're stabilizing the femur, okay? And you're pulling the tibia forward. I get the same effect. I like this better. And sometimes on the field it's a little easier. I don't know, what do you think? Is it easier to go this way, like this?
That's why I do it.
How you doing, buddy? You're going to be fine. Whoa! See that, Doc? We got one. And if he's 12, you're like, the tibia is stable in the knee, but the tibia is moving here on the growth plate. It's like, ooh. You seen one of those before? Oh, yeah, that's nasty. Fracture. Or you do a gap of the valgus, and it doesn't gap at the joint, it gaps below the knee. Because their growth plate isn't fused yet, and they just fractured the tibial plateau. Hey, no, your ligament's fine. You need a pinning, but your ligament's fine. Okay, so that's that. All right, so let's go ahead and